Happy holidays. Thank you for spending your 4th of July. Appreciate it. Welcome to the April CannaTech Chicago Meetup. I'm Zach Marburger. This is Kurt Akers. Sarah Johnson is also an organizer. And thank you again to Cresco Labs for sponsoring this fine event. We have a panel here that's really cool that topics we've never addressed before, so I'm a little on the nerdy side, so hopefully everybody can catch along, but if you get too technical, please raise your hand, ask for clarification, no questions too silly. So, again, starting by myself, Kurt and Soham. I think a handful of you guys have seen Soham before. He's actually in Denver celebrating with the Denver Post today, so he can't be here. So why do we do this? I see a lot of new faces. The main reason is to legitimize our industry amongst technical and ancillary professionals. In Denver, everybody thinks everybody's growing cannabis. Everybody has to be touching the plant, and they don't understand that there's actually an ancillary ecosystem of businesses that have sprung up with this opportunity. So a lot of the folks in here, minus a few, don't touch the plant at all, except for maybe consumption. So for that, we like to create a dialogue, share information so you guys can be successful in this new space, if you will. So, this started about 2 years ago. My company, Whaxy, and another company named Master Roots, which is a social network for cannabis consumers. We threw a hackathon, and we had overwhelming interest. We thought like 50 people would show up. We had 300 people sign up, all paid $100. We had to turn away several hundred. It was in the NBC Nightly News. It went fantastic. We knew we were onto something. Now this meetup is in 5 cities monthly, and we probably have about a monthly attendance of over 1,000 folks between them. So it's going extremely well. So one of the reasons that we need to legitimize our industry is for inclusion in a lot of services that are afforded to a lot of other businesses except cannabis businesses, even those who don't touch the plant. A lot of those logos up there you guys are familiar with, and a lot of those logos have shown unpreferential treatment, if you will, towards cannabis businesses. My Instagram for Whaxy has been deleted. My Apple app for Whaxy has been kicked out, let back in, and so on and so forth. I've had 5 bank accounts canceled, you name it. And a lot of other people in this room probably have the same challenges. So it's important to understand, the game that we're playing with these types of services and the best way to navigate these. And that comes with information. A lot of the times you can't just go into the bank and say, I run a cannabis business and I need a bank account. And you're not gonna have very much money. So just being aware of, other people's failures can help you along the way greatly. So I don't know how much you guys pay attention to cannabis news on a daily basis. I subscribe to it crazily. So we like to share the last 30 to 45 days of big events in the industry and how they may affect your business and or the legalization of cannabis. So the biggest event probably this month happened on Sunday, where the 24th state to join in the medical marijuana movement was Pennsylvania. So that's a populated state where there will be a lot of patients who get relief from cannabis and a lot of business opportunity. Additionally, the DEA chief, or just the DEA in general, issued a statement that said they would actually look at rescheduling cannabis by July and give a decision. That doesn't mean it's yes, that doesn't mean it's no, that means they'll actually give a decision, and they haven't commented on this in 20 years. So there's a real public outcry for some sort of information from the DEA, because the last time they commented on cannabis, they said it wasn't a medicine, or they couldn't admit it was as dangerous as heroin. So, they have a way to go, but we'll see what they say in July. And then today, actually from the University of Chicago's polling organization, they released a study via the AP that legalization across the board is at 61% right now favorable. That's the highest it's ever been in any type of reputable poll, Harris, Marist, or any of the alike. So that's huge, 61% of the country. That means Alabama, Mississippi, Louisiana included. So huge for the movement. Additionally, the United Nations is discussing global drug policy at a global level. They've recommended cannabis be descheduled here in our states, in the United States, and are just looking at drug policy as a whole, because I think it's clear on a national level that the ramifications of the war on drugs for the last 10 years have not been that good. So this is huge. This is the world's most powerful organization looking at this. So then, being the day it is, I'm wondering how many people know why 420 and how 420 and when, and does anybody know this story at all? I'd love to hear it.
Actually, I did some research on it this morning. There's a group of 5 guys in Southern California in high school. They went by the name Waldos, like Steve Waldo, John Waldo, and things like that. And they finally came out public a couple of years ago. They supposedly had a treasure map of somebody's weed farm somewhere in Southern California, so they would meet at 420 and go out and look for it. If there were athletes and after practice, they would go out and look for it, so it became 420. Let's go 420, and then they put that into other areas of the consumption of marijuana during their lives as well, and it became a bigger thing. The Dead got onto it, I think, around 90, 89, 88, and stuff like that. But I actually did some research on it this morning for somebody.
Awesome, it's spot on. After the Dead caught on to it, High Times started using it, and then it just became norm. It's the 420 that we all grew up with and is here today. So it's fairly interesting. And that was a quote actually that he gave today. I believe it was in a Huffington Post story. And he said, we were smoking weed a lot of the time, half the fun was just going to look for it, you know, because they were talking to him today. They're like, you know, what do you think about there's a dispensary on every corner? And he was like, it's no fun. You know, I like, back in the day we had to go hunt for it. So it was a really unique perspective. That guy is like 65 now and makes films. He does it really involved in the cannabis industry. So those are the big time events that have happened in the last month. And a shameless self-plug, actually Cresco launched Mindy Siegel's line of edibles in the stores this week. So you may have seen that on the news today, and that's the first real chef, if you will, James Beard award-winning chef that has entered this space, and that's one of those things that legitimizes our industry. Now, this isn't a McDonald's line cook coming to make edibles. This is one of the premier pastry chefs in the world coming into our industry. So those type of actions really legitimize it, not just for Cresco, but for our industry as well.
Hey, Zach, as far as news goes, one more, if I can add to it. And that's the Illinois State Senate voting, what was it, 44 to 17 to decriminalize cannabis. That's got to be on your list. Yeah.
Yes, absolutely. That should have been on our list. Kudos.
And I want to add one thought to that for the general consumption here, and that is what that means for Illinois. If Illinois were going to move toward more liberalized cannabis policy, what would we expect to happen? First, we would have to pave the way. You can't just wake up one day and say cannabis is legal in Illinois. It just wouldn't work. So what would you do? This is one of those steps. So
absolutely,
it's a very good thing.
Absolutely, thank you. And I read that in the Tribune, and I think it just escaped my mind. So tonight we actually have 4 folks, and pardon me, I didn't get your name on this until we got here today. We have Denise, Vlamis, pardon me, from the CEO of DispenseFirst, and a couple gentlemen from ACT Laboratories, Jeff and Jake, and then we actually have Kurt from Cannatopia. And we're going to have a panel discussion here, and I have about 3 prepared questions, but then we're really going to open it up for you folks. These guys are actively working in the cannabis industry now, both on the testing side, the dispensary side, and collecting data and working with brands. So really 3 different aspects and 3 different types of data, and really how their businesses function within this space is vastly different. So giving everybody kind of a different point of view is important. So if you guys can come up here. Welcome our panelists, please. So, can you guys introduce yourselves real quick so everybody knows who's who?
I'll start. So I'm Kurt Akers, CEO and co-founder of Cannatopia, a cannabis social network for modern cannabis users.
I'm Jake Aidoni, quality manager and lead research scientist of Akers Laboratories.
Jeff Nemeth, CEO of Akers Laboratories, founder, started about 5 years ago with our lab. We're one of 6 ISO accredited labs in the nation that strictly test cannabis only.
Denise, I am the founder of DispenseFirst. I'm a software engineer. DispenseFirst is a point of sale system that has full patient and employee information management integrated into it, as well as accounting. So it's one package that manages an entire dispensary.
Awesome. So, I guess kind of starting with you, Denise, being that you're very acumen and successful in other regulated industries, moving into cannabis in Illinois specifically, what were a lot of your, entering the market observations, and then did those actually come true, and how have you been operating the last 6 months? Or any horror stories, any success stories of note, if you will?
Well, not really. I do a lot in the energy industry, and especially for oil companies here in Illinois. So they are constantly, the state is constantly breathing down their necks from an audit standpoint. So, and data integrity and security is very important to them. So I kind of carry that into DispenseFirst and its platform. So it not really, we really haven't had any horror stories, except for, there are some challenges working with the state system, working with the state's vendor, which we're all going to, we all have those challenges. Not sure why, but maybe they just have limited resources to support us. We don't know. But I mean, that's really been our biggest challenge. The state, as far as the state's concerned, they came out with their rules and regulations, and I read them and I knew them. But all of a sudden, out of nowhere, we have some new ones. We're not sure where they came from, right? Did you guys experience that too? Yeah. So we're like learning every day still, and from a coding standpoint, it's a little bit difficult because, okay, you feel like, oh, this works, and now I have to make changes, and they're live, and I've got to make, have more resources to make sure that it's not going to crash these changes when we put it in there, we give it to them. And also, I think that just the basic nature of the industry, everyone's new to the industry, and so we're constantly working with everyone that's new, our clients. So that's, it's kind of sometimes the blind leading the blind. So I think that's the biggest challenge, maybe that's the biggest challenge in this industry. Trial and error.
For you guys who
Exactly.
don't know, unlike maybe a 7-Eleven, right? The state may know how many tax dollars or tax particular, classifications of products, if the 7-Eleven sold alcohol or sweets or what have you. But on a daily basis, the dispensary uploads more or less a manifest of inventory, so the state has full trackability and traceability insights into what any particular dispensary grows or sells and any particular cultivator grows on a daily up to the minute basis. Those type of insights, are not there with any other type of industry at all. So that's the type of hurdles that she's talking about, is keeping people compliant. Is the number one goal, if you will, of any particular software platform or in this space. So same question for you guys. I mean, from a different perspective, you guys are providing a function that's not only for the industry but for patients as well. So they know it's in their medicine, so they see what THC percentages are there, or terpene analysis, etc. How have you guys faced similar challenges in the industry, and specifically straddling both lines, if you will?
Well, some of the things that we saw, we've been testing cannabis for 5 years in Michigan. We have a full lab in Michigan, to give you a little history. And we decided to come into the Illinois market, and was working with the regulatory committee right along before they even gave us a license. And all of a sudden they said, okay, we thought we were gonna have a big application process like the grows did and the dispensaries did. Our application was, here's our ISO, our accreditation, and they gave us one page that here you go. And the regulatory was so tight here in Illinois. The rules are so tight, 10 ppm, the chain of custody problems, the biotrack tracking, the way they wanted to track the testing. It's not working, a lot of it. So I gotta say the state has been very helpful and has open ears and taking suggestions and meeting with all the labs in the state and kind of looking for better practices. And I see a future, a really good positive future for that. But it's been a tough go. Just gotta keep hanging in there. Like, we're fighting for less regulation, a little bit too much testing. We're trying to get some of the testing taken out that we feel that's totally nonsense, to keep that cost of the medicine down to the patient, because that's our first thing. If we don't have to charge as much to do nonsense testing, we know these girls are doing a great job, let's pass that savings on to the patient, bottom line.
And explain, I think PPM probably didn't resonate with folks.
Let me know what PPM, sir?
It's a critical part, right, of the
Well,
testing.
it's one of the, anything that's an oil or an edible, when you do an extraction method, you use a solvent. So that solvent we measure to make sure there's not parts per million.
Yeah.
And the state regulations in Colorado are 600, Washington's 400, Illinois is 10.
For example, that's 0.001% of either butane or ethanol, which you guys know for an RSO isn't gonna happen.
And if you had drink a can of beer, or a bottle of beer, that's 5,000 ppms. Oh, stop, that's dangerous, according to the regulations. So that's one of the big things that we are working on really hard right now to get that number up a little bit. But fortunately, our growers are really making strides and really, but I think it degrades our medicine when we do this. Because we have to heat it and purge it to that point to remove all that product away from it. So we're heating it up so hot, we're losing the terpene values, and it hurts the medicine overall.
What was the scientific basis to come up with 10?
It was one guy said 10.
It was-
There couldn't have been any research done.
And it sounds like a number to set the program up to fail.
That's
Yeah.
basically, it was, when we were talking to a fellow from the regulatory committee way back last year in September, when they were going through some of this regulations, they said, oh yeah, they hired an expert. And basically, they went from the pharmaceutical industry, where if you were making a medicine, you
Sure, they can't pick a competitor
to do it. So, they just kind of shot themselves in the foot.
Well, for example, if you smoke flour out of a pipe and use a butane lighter, you're ingesting 400 ppm per head. So the 10's absurd in every way.
I think what makes it so difficult for you guys is that there's no uniform standards, right? So you take what's here done in Illinois compared to Colorado, you mentioned Washington, there's no uniform standards that people can kind of take or model after, so then it affects the quality of cannabis from the West Coast, Midwest to East Coast.
And you're seeing a lot of the states going to that uniform, and one of the biggest things at the labs, that I mentioned, the ISO 17205, it's an accreditation, it's a national standard. So in the industry, we're seeing all the states requiring to have this ISO before you become a lab at that state, so they can actually have some standards put into them.
Question, could you talk a little bit about some of the other products or substances that you test for that are not butane? For instance, maybe pesticides, miticides, fungicides?
Yep. In Illinois, we're required to do pesticide screens, mycotoxin testing to the part per billion, microbiology screen. There's 6 different categories, genuses that we need to test for, including Salmonella, coliforms, E. coli, total viable yeast and mold, and Enterobacteriaceae. And then also we do potency, and we do the residual solvents, and we do terpene analysis, not for safety, but just for the customer's information.
And what are you finding out? Are you seeing a lot of problems with people illicitly applying pesticides to the medicine or something like that?
Illinois got it really locked down on the pesticides. They're not allowed to use pesticides in the flowering stage, so we haven't run into any problems on that side. The biggest thing is the mycotoxin screen is unnecessary, in my opinion. The limit's 80 parts per billion. We've never hit above 10 on anything.
And like they said, if you go out to Colorado, there's a huge difference between 10 and 600, right? Like this, where are we at with this? So I think 10 is absolutely unreasonable. But at the same time, with all your other testing, for microbials and pesticides being required, that's not required in Colorado. And so a governor's decree about 2 months ago, and when he called a public safety, outcry about it. So, this is, to quote Joe Wright, if you will, from a couple months ago, this is a feature, not a bug. While they may be very restricted features, nonetheless, at the end of the day, patients are still getting super clean medicine. The flowers here and and for that matter, the concentrates, from a cleanliness standpoint, maybe not from a medical efficacy standpoint in terms of that ppm number, are really getting awesome medicine relative to other gray or regulated markets where it's kind of a crapshoot sometimes. So for that matter, it's a very true medicinal purpose and approach.
Is it sustainable and scalable?
Yes and no.
I mean, over a period of time with trial and error, is it?
You know, I think if we get that regulations up to 500, 100%, our biggest problem is the ppm, and some of the other ELISA tests and mytoxin tests that we're doing is ridiculous. But yes, it is, and it just comes down to the quality. But as far as cleanliness, like you said, you got the cleanest medicine in Illinois.
Do you have any focuses on industrial hemp? Do you work with any of the cultivation?
We haven't seen hemp come through. I don't think even the cultivators are growing hemp here. They're focusing on the cannabis.
Yeah, that's what I've seen as well. Just wondering if that's coming in and if you're getting any
We're seeing some of it in Michigan.
discussion of it on your end with the Illinois legislation.
Nothing in Illinois yet.
Anything like 1% THC. I think that's what the threshold here is in Illinois.
Yeah.
1%.
We haven't seen it. In Michigan, it's starting to pop in Michigan and some of the vape stuff.
What kind of ELISA tests would even be relevant? Because ELISA is antigen-based. What are you looking for?
The mycotoxins, the aflatoxin and ochratoxin. There's a great company, actually, Romer Labs, that did validation studies on their aflatoxin and ochratoxin tests.
Do you just work with dispensaries, or are you gonna be opening it up to end users and consumers?
We actually brought that up to the state. We only work with the cultivators currently right now. It's the only people we can actually test for. In Michigan, we test for anybody. And that's, we find a great value, mostly against parents and children. Huge. We have a huge parent base that come to the lab that we test all their products free for their kids. But here in Illinois, the only people we're allowed to actually take cannabis from are the growers. And we actually put a petition in to say, hey, if a patient really wanted to double check this, or if they made their own edible or something out of their flower, are they allowed to? So we had a couple patients call us.
And that's the same law in Colorado. I mean, the Denver Post just actually got reprimanded for taking a handful of edibles and strains to go get them tested on their own, and they wrote a story about it. Tons of traffic, and they also got fined by the state. So many of the programs are set up exactly to be like that. And so even from a consumer's perspective, pardon me, it's important to know this information. How often do you really look at your nutritional facts, right? And probably not. I can't remember the last time I looked at any fat calories, if you will. So from that perspective, the flow of this data from party to party to party, so consumers can access it in their purchasing flow or when they're on a social network or what have you, will become the norm. And it's a truncated fashion right now because of state traceability systems and otherwise that really makes this data hard to get. So Denise, from your perspective, excuse me, have your customers, sought after, these automatic data connections to testing labs so that they can take that type of data and, disseminate it to their patients through other applications or just make it more available so that their patients know?
For sure they want to, but the data is just not accessible to them. And these guys' data is in BioTrack in the state's traceability system, but unfortunately their API to pull that data, the data doesn't even exist in there. And they're only tracking for levels, and that's all the state requires, I think, here in Illinois. So we don't even have access to that data. So it is on the bottles that come in. In Illinois, everything is prepackaged. So they're not just getting like bulk product. Everything is coming in packaged. It all has a batch number. And some of that data is on the package, but otherwise, if they don't input it right now, there's no way for them to share that with their patients to even analyze, okay, what for this patient with this condition, and probably maybe for this patient, what combination, may work. I mean, we can't even do anything. We can do no intelligence reporting whatsoever in that area.
How does the certification requirements translate to, actual product being sold to the customer? The certification requirements, I mean, once a cultivator
Gives
provides
us-
you a product to analyze.
Basically, once they turn it into us, there's the tracking system, BioTrax tracks it, they create a manifest, that product gets shipped to us. Actually, we go out to the cultivator, we pick our random samples, so they can't mess with it, we put it in the sealed bag.
It's surprising, like, hey, we're
Oh, no,
getting
they
this.
call us, they gotta call us.
Okay.
Cause they're ready for sending products out. And so we go there, pick random samples, then we have to seal it with chain of custody, give it to them back, and then they have to transport it to our lab. And it's chain of custody always that's another rule we're trying to change, is that's a day wasted. Why we're already there, why aren't we just taking our own product, right? It's kinda silly, so after that, then as soon as that manifest hits our door with the product, it automatically pops up on BioTrax. And BioTrax, it's very limited what they're asking for, but what we test for, like, instead of just testing for the 4 cannabinoids, we test for 7. And we provide a big sheet to the cultivators that use our services that has the full terpene analysis, so it would be a very useful thing at the dispensary level to get that full sheet information. So, but unfortunately, we don't do all cultivators, we only have a select cultivators that we're doing business with. But then after that, we report it. But BioTrax is very archaic and it doesn't work.
Are you entering that data into BioTrack, that QA sample information, or is the cultivator entering it into
We are.
BioTrack?
We enter
You
it.
guys are.
The terpene data is not all the data we provide, the cultivator gets in there, but we enter it. So.
Is BioTrack accessible to the public or only to the industry?
Only to the industry. And that's something we ask for a rule change too, like we have a beautiful website that we can share medicine with all the time, we can't do it. They don't have it.
I'm curious at the end of the day what the cost per pound is, to get product out the door, fully certified and tested. If you guys have a sense for that, if that's maybe a better question.
Well, the batches is coming, right now, the batch weight has not been established, it's looking anywhere between 10 and 12 pounds. And it's up to the cultivator to decide what that batch is, but we recommended up to 10 pounds to be max for testing. And for a full bundle, it's right about $350.
And that would clear 10 pounds of finished product.
Are you guys testing fresh from the plant, or are you testing dry product?
Dry.
Is
Finished
that because
product.
it's easier,
Oh, we can
better
test
to test, or is it that's just the way?
It's the way it's going, and it's a more consistent result, especially with the potency. If we tested wet, then obviously the potency is gonna be lower because it's weight percent,
Right.
and water adds so much. If we test what the consumer is actually gonna be getting, we can give them a more honest number.
So about extracted materials, you're testing the plant material, but people do make modifications, food extractions and things, they go back and test it once it's
all
extracted.
finished product before they have to, before a finished product gets done, it gets retested.
Back to the $350 figure. What does a company get for that? Is that an exhaustive, is that an exhaustive analysis?
Everything the state requires plus the terpene analysis.
How about, sorry, in terms of cannabinoids, not
7.
including terpenes, 7?
7. We're doing 7 right now.
You said that.
And how many of you guys, I mean, I'm assuming there's not terribly many medical patients here in the Illinois program. Think about the last time you purchased cannabis on the street. Did you ask your dealer, right? What's the terpene profile? What's the CBD? So this is awesome information you can have, in a regulated environment to make an educated decision when you're purchasing something for your condition or for your personal taste. So, this is one of the greatest reasons for regulation is access to clean medicine. I can tell you in Colorado and California, where there's people blending into the legal framework, where there's 43 busts on Monday, guarantee you that cannabis was caked in pesticides to keep the powdery mildew down and so on and so forth. So again, this is a feature, not a bug. I would love to have the ability to shop based upon these features.
That's what he just said right there is the biggest point, is who cares what the name is anymore? get away from names. Look at the values, look at the cannabis profile, look at what terpenes are there. And remember, if that's your medicine that works good for you, look for those other ones that match up to that test results, because that's how you shop for cannabis.
So, question with that, are you finding any consistency between growers, for strains? I mean, are strains predictive of the cannabis profile, the terpene profile?
The ratios between the cannabinoids, yes, the levels of them, no.
Okay.
I think a lot of that has to do with growing conditions and actually lineage, like,
Right.
our
Well,
growing
that's
blue,
what I was
right,
wondering,
maybe,
is
right.
the histories are all, like, who
Sure.
knows what the history is, so that's.
I think the tough part's also giving that information to the consumers have, right, getting it in front of them, it's not easy for you guys to do.
Well, if it counts as advertising at all, we can't do it.
Yeah, exactly.
And so that, I guess that's where kind of your platform, Kurt,
Yeah.
comes into play.
So
And
we
then-
would, like, for us, we'd like to take that kind of data and give it back into the consumer's hands, so that they can understand what they're trying to buy from the dispensary. One of the things that we've kind of developed now is, we call it managing the cannabis experience, from a very simplistic form, where users can take that product, input the basic information into it, so they can start to understand their experience around it over time. But taking these types of terpene profiles, and cannabinoid profiles, and giving them more in-depth insight, something we would want to take and try and give to them.
That'd be great if we can, I mean, we would release that if that's.
Do you see the cultivators taking your information and doing more exploratory combinations of the terpenes and cannabinoids and coming up with different profiles?
It's too early in the game.
Yeah.
A
It'll
lot of-
get there
it'll get
quicker.
there. Yeah, I think a lot of them have that in their vision and plan, but I think they really care about the patients, so I think we'll see it.
We see that in Michigan pretty consistently. You see a
I
million
know Colorado
dispensaries, the
has-
ones that last are the ones that take their time with their patients, say, oh, you need it quick, when you want it quick, oh, have some myrcene. Or you want it to last longer, go limonene. They're getting deep into it and they're giving the patients what they want.
This takes a little bit of time.
So I think one of the challenges in Colorado has been, there's so many different matrices, candy bars, gummies, muffins, you name it. And obviously the extraction methods are wildly different for all of ththose. So you guys are ISO certified. Does the ISO certification address extraction in different matrices? And how have you seen, coming here to Illinois, have you guys had any issues with consistency with other labs because of those techniques?
Let me take this one. Yeah, the extract edibles is one of the most difficult things to do. And to do edibles correctly and to homogenize a full sample and to get an accurate number is very tough. It's a lot of research per grow facility when they come out with a product. I can say we've tested probably everything you can imagine in Michigan. We've worked with a lot of large edible companies already. So we do have a lot of different methods and breakdown chemicals that we use. We're pretty happy with our edibles. We're probably one of the top leading edible testing labs in the nation, I think. A lot of our stuff's been nationally known in the edible community, because a lot of the top edibles guys get judged on their accuracy of their labeling. So if they say it's 100 milligrams, it's got to be 100 milligrams. And the only way they know that is through our test, and by our testing and verifying with 3 other labs when they do those tests, we're hitting right on it. So it's kind of a trade secret also, because that's what, a column's $1,000, and you blow through a lot of columns that the edibles get stuck.
Yeah.
We haven't made money on edibles.
It's interesting, the first recall in Illinois, yesterday, but we haven't been informed by the state yet, but we just know that our patients get purchased our gummies. Yesterday, gummies, first recall.
What kind of recall?
Don't know, we haven't been informed, we just know the message coming back from the state system is, this batch number has been recalled, it's gummies. Yep, yesterday was the first time. So it's interesting you say it's so difficult, because it's probably that it's mismarked, it was like 20 and 8. Yeah, it's probably mismarked.
Right.
You probably didn't test.
We're not allowed to disclose anything.
These lovely cameras that are in all the cannabis dispensaries in Illinois, has somebody
we determined whether these are also being used as meticulously close listening devices through the camera, or are they just, as they would have us believe, watching out for the bad guys?
Well, to be clear, the state doesn't install those cameras.
Oh, they don't?
No,
I thought,
the facility installs.
I
them.
thought that the state had the privilege.
They have access to the footage.
They do.
They don't install the cameras
I thought
themselves.
they were watching the footage live.
24/7 at the dispensaries. At 24/7, they are supposedly watching.
Right.
And, every square inch and a certain part of the perimeter has to be covered. So, you know, by the security, and especially supposedly, once a week, dispensaries have to set a special time with the state where they're gonna dispose of the bad product. And that camera has to be right there on that disposal area.
But as far as constant monitoring by the Illinois State Police.
We don't know if they're actually watching, but yes, they have 24/7 access to our security feeds.
And that includes audio, is that correct?
I don't think that's.
I can actually
I
speak
don't
to that,
think
because
so.
some of the systems, because I know some of these systems that have been installed, they have audio enabled. So I don't know if they're listening, but theoretically, they could be listening if they wanted to.
And to be clear, this is status quo. If you go to I don't know exactly what the Colorado regs are, but if you go to a Colorado dispensary, same setup. I mean, you have cameras everywhere. If you go to a Washington dispensary, same deal. I mean, more often than not, on the dispensary side, it's for security. They've been targets of properties again and again. There's a lot of cash at a lot of dispensaries.
I think what he's trying to touch on though is like that big brother aspect, like that's before, where you know, they're looking at you through the poster, and that is very creepy.
You never know, you never know, but that's good too from the standpoint that, it kind of, keeps an employee, it gives them second thoughts.
Keeps you honest.
It keeps you honest, exactly.
It keeps you honest, but it is an invasion into what has always been kind of a private business, right? Like any other type of business, you wouldn't expect the government to be watching your cameras.
Well, you don't know.
Does anybody know? Do they have anything to do like this?
No.
No? Okay. I was curious. Interesting.
And, maybe the last point on the cameras issue, it's exhausting to be on camera throughout your entire workday. That it drains the person, because, I'm sorry, did you just say that, or who just said that it's always kind of on your mind a little bit? That's Chinese water torture. It's one drip after another. It's always on your mind. It takes a toll on the party meetings, or
Especially the agent in charge in most of these dispensaries, because the agent in charge has certain responsibilities and no one else can perform those responsibilities. And there'll be time, I mean, agent in charge is in the restroom, and then, you know, a patient needs something, or something has to be taken from the safe. You know, an employee can't do that. So it does put a lot of pressure, I think, on the agent in charge, for sure.
Rahul Khare, I'm a physician and an advocate and certified with a significant amount of patients. How are you guys interacting? One of the biggest problems in Illinois is that physicians don't feel comfortable certified. How are you changing that in any way? What's your guys' outreach to physicians and each of you guys' experience?
You know, I have no experience in that area. The state's pretty strict on what the dispensaries can do, but I know there's some people in here probably that can definitely answer that question better than I can. I don't know if any of us really are prepared to do that. But I'm sure there's a lot of patient advocacy people in here. Is there anybody that can answer that?
I mean,
Oh, yeah.
I would say
So-
physicians hearing from other physicians would be actually great.
So I work with a staffing firm here in Chicago called Cannabis Solutions. We're currently working on a search for a director of community outreach whose focus would primarily be on physician outreach. And, you know, the person that we have in mind for this role ideally comes from like a med sales rep background or has experience already in the medical community that, you know, is comfortable sharing this information, creating like marketing materials directed specifically towards the doctor demographic, because, no offense, you guys are a different breed, in the way that we can actually communicate the science of cannabis and the actual medicinal benefits, so, you're gonna start seeing like a lot more dispensaries. I know there's like not-for-profit organizations that have kind of been doing some, patient outreach, but there really hasn't been too much on the physician side, but that's definitely something that you're gonna see a lot more dispensaries, like once their market matures, that they're going to start, funding like people to be in this role as a physician outreach person, but a lot of advocates themselves are just kind of taking it, taking the responsibilities on their shoulders and creating their own materials or joining like not-for-profit orgs that, have this cannabis 101 material ready for them and presenting it to their doctor and just really being persistent in their approach, because they want their medicine and they want it like their doctor to certify them, because they have to, if that doctor doesn't, then they have to go to another one, then go through their whole, medical history, and it's uncomfortable. So they really want to push for physicians, and that's something, like I said, you're gonna see on business side, but you're also gonna see on patient side as well, so.
I know you're a little familiar with what we've done at Cresco, but, we work with several dispensaries, and they've hired a lot of folks, just like she said, where there's a champion of outreach, whether it's to the patient community or the doctor community or both. And, it's tough work. This was a project I headed up at Cresco, and we slammed on this for 3 months. We spent a considerable amount of money. We talked to a lot of folks, and it is tough. And that's one of the challenges. It costs money for outreach. And, right now with that kind of gridlock at the physician level, where you have whole doctor communities in the South where the nearest hospital is, serves everybody and they can't go to that particular place. There's real challenges. So I think for the most part, I think dispensaries are really driving that conversation as much as anybody, because they need patients at the end of the day. And so to be a viable business, and
But I think we all do.
Sure, absolutely.
Every part of the industry needs patients, and if that's the bottom line, I think it's really important to come together to fix that one. I mean, people say we want more conditions, that's fine, but if you don't have the physicians doing the conditions that we have now, which are pretty severe and significant, and we have a huge amount to go through, it's gonna be fun.
Yeah, we had, there's a few of us in here that belong to an organization called Women in Cannabis, and we try to do these outreach programs, but, it seems that the issue is that it's very hard for us to identify physicians who are willing to participate. I mean, physicians listen to physicians, right? We just had this issue. So, if we could get, and by the way, Illinois Women in Cannabis is not just for women, it's open to men too. So if anybody wants to join, they can. They what?
We also listen to farmer reps.
Who does?
Physicians.
Oh, yes,
We
yes.
also listen to farmer reps who fly them to, corporate meetings and other
Yes, yes.
pharmaceutical-based.
So, I mean, if we could get more, physicians involved and out there, like, spreading the word, I mean, we tried with it, maybe nurses too, and, physicians aren't gonna really listen to nurses. I mean, I don't know why, but they won't,
It's that dilemma, right? So
Yeah, it's
like
that dilemma.
Like you go to school for 12 years to be an MD, and now you're taught something different, or you're getting exposed to something that's kind of contrary to a lot of people being taught that way. And now it's like, does a physician listen to his patient? Yes. Does he listen to everybody talking to him? Possibly, maybe not, but it's gotta come from a higher up, right? It's gotta come from the top down for this kind of things. No matter how much patient advocacy you've done, it's a great thing, it's amazing, but it's like, unless they're gonna get the okay or go ahead or go, hey, I'm not gonna get in trouble for this as a physician, or I'm not going to feel criticized for this from my peers, it's hard for them to come on board from what I've seen.
Well, even just validating it as a real medicine, as opposed to just thinking.
Somewhere in between where we're at now and where Colorado's at, I think is probably the future. But I would say in Colorado, I think it should be more restricted on the medical side. And I'm a card-carrying holder for the last 3 years. So.
Wasn't that the idea with the setting up the Illinois HBO 001 was to set the standard for possible national legalization? I mean,
I couldn't speak
the 10
intelligently to
ppm
that.
is a little, obviously, way ridiculous of a standard to set.
I couldn't speak intelligently to that particular point.
So, from a clinical standpoint, has there been any new research showing that cannabis can cause health setbacks, either in adolescents or older adults?
I mean, there's a lot of studies that come from outside the United States. With the current scheduling, it makes it fairly difficult to have really any large, blind sample or medically approved or respected study. So the information can, he's the doctor, not me, to be clear, but I don't know that there's been a lot of information that doesn't come from Meetup that has shown anything new in the past couple of years.
Yeah, and I agree with that, and, as a Schedule 1, as you guys know, you can't do the studies that you would do from an FDA-approved study of any pharmaceutical drug. So, and you can't compare that. And this is the problem we have with physicians. They rely on these studies for new medications, but we don't have that. So it's hard to talk to them. And there's also not an influx of money to educate. The state said they were going to do that as part of their budget. It didn't happen. And so now you have a new drug out there, which has been, by the way, until about 5 months ago, illegal in Illinois. And all of a sudden there are 30-some conditions that it can treat. And physicians, naturally, without any literature or any education, are naturally going to be a little bit skeptical, which they should be about any drug. But the problem is now, how do we educate them? And I do agree that we have to learn from the pharmaceutical companies that have studied it and it works. There has to be money probably from the labs, the growers, the dispensaries to educate, because the state's not going to fund it. And then you'll have to have physician champions that will hopefully educate and do it. And the lethal dose of medical marijuana, there's no studies that show how that it's impairing the youth. But there's also not a lot of studies that show that it helps a lot of people either. So that's the
there are actually a lot of medical journal studies that do show benefit.
Not to the extent that we really feel that it helps people. But you're right, it does help with nausea, it does help with these symptomatic things, but you wait until it can be a Schedule 2 and we can do real studies on epilepsy that we know anecdotally and with very small numbers of patients work. And then it will be a medication that is promoted and used.
Well, we got 2 more questions. You and you. Go ahead.
I was just thinking of for the doctors, the endocannabinoid system, but there's more that you could study about that, right? About the receptors instead of the actual cannabinoids itself.
Absolutely. I think it's a whole thing, but I went to med school and they didn't talk about it whatsoever.
Yeah, exactly. And then
So they're starting to teach it, but it's, even the pharmacists don't talk about it. So it's just not well discussed and studied, and again, the research, it's not
That's what I
accepted.
mean, like you can research that.
But there's no drugs for it. What are we gonna, it's a system, we know it's there, but we're not testing drugs. The pharmaceutical companies aren't testing it and showing how it works. So I think that's the issue.
And you see, there's one company that is as much pharma as they are cannabis, and it's called GW Pharma, and they're a British company that I think currently have 2 FDA trials going on, and they're a unicorn. Like, if we wanted to do this, it wouldn't work, right? They are the guys who have synthesized a couple cannabinoids and have shown promise, and there was actually a sativa study here in Chicago a couple weeks ago that had really good results, and that was with GW Pharma. So you're not going to wreck the system that's been in place for 60 years. Doctors have a certain way of doing things that's very comfortable and not necessarily broken. And I think it's inherent upon cannabis to almost find their way to fit with inside of that system and create a new one. I think that's the kind of
Just briefly, I think what's holding back a lot of doctors too is the fear of lawsuits. And that's gonna be an educational process too. And I think that should be balanced with the information of how many people are overdosing on opiate drugs these days that are legally prescribed, and counterbalance those arguments with that information and the threat of lawsuits that can bring. and does threaten.
I certainly think that's an area that the medical cannabis community specifically is going with. You know, the statistic where it's like a considerable amount of medical marijuana states have really low opioid abuse. And that was a study put out, I forget, maybe by the CDC, but it was a very reputable study. So it's more than coincidence for that matter. But we are out of time. I want to be cognizant to these guys this time. I really appreciate you guys coming on 420 and sparing your festivities until after. Thank you to our panel. Really appreciate you guys. We'll see you guys next month, and at any time, please email me feedback, suggestions, events through the Meetup page.
Are we still doing the jobs, call for jobs?
Absolutely.
Okay.
There we go.
And now we are. Hi, everybody. I'm Amy Corin. I work for a site called cannabis.net. We're a site for all things cannabis. And we have lots of job opportunities, specifically for writers and bloggers and contributors. And I have to say, I was absolutely blown away by the dialogue that went on tonight in the past CannaTech meetups that I've been to. We are open to any type of personal opinion stories, personal interest stories, news stories, opinions, industry trailblazing, facts and things like that, getting the word out about physician education and things like that. So we're totally open to all different kinds of unique perspectives. If anybody wants to talk to me afterwards about being a contributing writer, I would love to invite you to participate. And secondly, we're also hiring sales folks to do telephone-based sales for doctors, dispensaries, and lawyers nationwide. So if you are any interest in either of those type of roles, please see me afterwards. Thank you very much.
Hi, hello. Like I said, I am Amanda Guerrero. I work with Cannabis Talent Solutions. We are currently hiring for, like I said, a director of community outreach, but we're also doing a dispensary agent. So that's going to be like more of a patient intake person. Your cannabinoid level or like knowledge of that, I'm not going to stress on it, but definitely ideal for you because this role is going to kind of be utility throughout the dispensary where you may have an opportunity to actually like work with patients and recommend the strains that are in the store. So if you guys are interested in that role or learning more about it, find me. I have my cards and I'd love to talk to you.
And I know I spoke to a couple of you guys today, but about applications you previously submitted, but CrescoLabs.com/careers, I think there's probably 20 jobs there. Anybody else? Awesome. Well, thank you guys so much for attending. I really appreciate your patronage, your dialogue, everything you're adding to the space.